everyone, welcome to East West Horizon. This is California. Have you tried Chinese medicine in the United States? Maybe not everyone is so lucky. Doctors who can practice Chinese medicine is not available in most parts of the United States. Fortunately, in areas with a large Chinese population, traditional Chinese medicine stores and traditional Chinese medical practice are treating and saving people like unsung heroes, especially during the pandemic, guarding the health of Chinese Americans. In the past 2 years, the coronavirus has rampant across the world. President Biden recently issued a statement on the White House website saying, "In memory of the 1 million American lives lost to the COVID-19 and their loved ones left behind," he orders federal flags to be flown at half-staff. NBC reported that the 1 million figure is equivalent to the total population of San Jose, California, the 10th largest city in the U.S. This is a loss unthinkable. The staggering speed with which the U.S. has reached that number from the first confirmed case of the coronavirus 27 months ago to today. Behind that 1 million deaths, hundreds of people are affected. The total number of people affected is exponential. About 200,000 children in the U.S. have lost their parents or primary caregivers and become COVID-19 orphans. A report written by U.S. public health experts shows that, due to the impact of the pandemic, the average life expectancy in the United States has declined for the past 2 consecutive years. By ethnicity, whites had the most deaths overall. One reason is that the white group has the largest population, and their average age is older. However, in terms of age standardized death rate, African American and Hispanic population as well as Native American Indian groups are disproportionately represented in COVID-19 death. However, to everyone's surprise, although Asians are also a minority, but they have a relatively low mortality rate. Mainstream media blamed the unequal distribution of healthcare resources and low health status for minority death toll. However, this conclusion does not apply to Asians, especially Chinese. Why? In the U.S., when you make an appointment to see the doctor, the waiting time is quite long. Here we have doctor at our store and have Chinese medicine. You may also bring in your prescription in Chinese medicine. We can get you refilled. We also have ginseng and lotus seeds and other nutritious supplement for daily usage. We also have some ready-made Chinese medicine like 六味地黄丸. Gao Yun, a Chinese medicine practitioner in Silicon Valley Bay Area, came to the United States in the 1990s. He has cured countless patients during the pandemic. In the past 3 years, I have cured some COVID-positive patients. Their common symptoms are fever, coughing. After taking about 7 to 10 sets of Chinese medicine, they recovered. For the sequelae like chronic coughing and stress, we also have cure for them too. According to the theory of traditional Chinese medicine, no matter how the name of the virus is changed, the laws affecting the human body are not much different. Inner heat, poison, and dryness are all the ways that external viruses invade the human body. Among them, the new coronavirus mainly attacks the upper respiratory tract. The theory of traditional Chinese medicine has a history of more than 2,800 years. According to my experience in the past 3 years, no matter how the variants changed, the common things are they attack the upper respiratory tract. The virus become the inner heat and dryness and make throat hurt and itchy. Coughing and stuffy nose. Nothing to surprise. Some severe cases are cured after 10 sets of Chinese medicine. The results are great. The virus does not favor any ethnic group, but the mortality rate of Chinese people during the pandemic is lower than that of other ethnic minorities, which is inseparable from the use of traditional Chinese medicine. From New York to California, cities with traditional Chinese medicine stores have been very busy. 德诚行, 德元行, and many ginseng medicine stores in California almost never shut down during the pandemic. I have lower back pain. Today I come to see Dr. Gao, and he will do acupuncture to me. And after acupuncture, I feel really good. He's really great. The virus will never pardon anyone. Chinese people have been able to fight against the epidemics time and time again in the long history. It can be said that traditional Chinese medicine has made great contributions. Here's a case that doctor in Western medicine believes only surgical removal of the organs can cure the disease. But Chinese medicine says no need. I have metrorrhagia, lasted for 3 months. Western medicine doctor could not cure it. Their final conclusion is to get rid of my uterus. After bleeding for 2 months, I came here to try Chinese medicine. I met Dr. Gao. He used acupuncture and Chinese medicine together. It takes only about 10 days to stop the bleeding. Dr. Gao said, I can help you stop bleeding and adjust your inner condition. The Western medicine doctor asked me to take out my uterus. Of course, I rejected it. Dr. Gao even said I could pregnant if I want later. Miss He went to see Dr. Gao today. Her story may be one of the amazing cases. Due to unprovoked metrorrhagia, Miss He kept bleeding to the extent of severe anemia, and Western medicine could not stop it. In the end, the only method of Western medicine is to directly remove the uterus, remove the organ that is bleeding. In this case, Chinese medicine theory believes that it is not the uterus that is wrong, but that Miss He's body is out of balance and cannot manage blood circulation. Chinese terminology, insufficient vitality cannot control blood. The human body is like a sophisticated machine. Sickness is like a puzzle. There are many ways to solve the puzzle. What is the best way to solve it? In this case, hysterectomy should not be the best option. In thousands of years of Chinese history, plagues, typhoid fever, and trauma are countless. And the TCM theories summed up by Chinese predecessors are all playing a critical role in curing diseases and saving people's lives. From the ancient doctor Bianque Huatuo Zhang Zhongjing and the medicine king Sun Simiao, to the modern doctor Li Ke and Zhong Nanshan, the masters of Chinese medicine go from treating the sick patients to treating the non-symptom patients, which means starting the treatment after the outbreak of the disease and preempting the disease before the outbreak. Preemptive intervention is the peak of human wisdom to cure disease. Like an unsung hero, Chinese medicine has been protecting patients in both the West and the East, but its own development is very challenging. Except for acupuncture, most medical insurance in the United States does not cover Chinese medicine. Therefore, patients must decide between treatment and a financial burden. The coronavirus is a crisis and a turning point. WHO recommends that member countries consider incorporating traditional Chinese medicine into their medical systems. Consider using China's integrated traditional Chinese and Western medicine treatment model and promote international clinical medicine. Well, that's all for today's program. Please feel free to share your story of using Chinese medicine. I'll see you next time.